An anthrax outbreak, a rabid animal, drug-resistant bacteria. These might sound like your worst nightmares, but for the scientists and epidemiologists at the Department of Health, it's just another day on the job.
When you go through and you see all of the nasty, viruses, chemicals, and stuff, it's nice to know that we've got a place like this that help protect the public.
6 members of the House Health and Human Services Policy and Finance Committees and House staff toured the Minnesota Department of Health's world-class lab in St. Paul. The group saw newborn screening up close, water being tested for contaminants, and learned how unknown substances are cautiously analyzed.
I hadn't seen the facilities that they have for sort of dealing with unknown substances that might come in, and that's a big concern these days when you don't know if there's going to be some kind of bioterrorism incident or different things can come up.
Liebling, who chairs the House Health and Human Services Policy Committee, says tours like this strengthen relationships.
Ultimately, the legislature sets the policy. So it's very important to have this kind of flow of information back and forth that they know what our concerns are as legislators and what our constituents' concerns are, and that we know what they're doing as professionals and what their concerns are and what they need to do in order to keep Minnesotans safe.
The tour may even have the potential to shape public policy.
It adds credibility, and it also gives us an idea of capabilities. You have things come up, something new, and can we do that or handle it, or how would we integrate that into our programs? If you know what the general capabilities are, then it gives us an idea of what we can do. So policy-wise, I think in the future we'll know, hey, we could do this here, and then do we fund it? Do we, where does it fit into the group and the budget?
An example of the legislature implementing a policy change last year that the Department of Health will be screening for is a non-invasive test to check for critical congenital heart disease.
These are the types of heart defects that require intervention within the first year. So we're really talking about ones that have a huge impact on families, certainly on the child. And so it's just really important for us to be able to screen for it because a lot of these are missed. They're either missed prenatally during the ultrasound, or they're just missed at, during the primary care checkup in the hospital. Maybe they don't hear the murmur. Maybe the kid looks really, really good at that moment, and it's not until later that they start to turn blue and they have problems. And if they're at home when that happens, that's really bad.
Genetic counselor Amy Gaviglio hopes that the Department of Health will begin screening for the defect in January of 2014.
It's another test to check for these things that we know we're missing, and we know if we catch them, we can for sure save lives.
Just one incident of the legislature and Department of Health working together.